Hi, my name's Rebecca McLoughlin. I'm a physiotherapist working within the red cell pain management team at St George's Hospital. Over the next few weeks, we're going to release a few short videos that have got some ideas for ways that you might integrate a little bit more movement and exercise into your daily routine. There are a few things that we'd like you to hold in mind when you think about moving and exercising, particularly in the presence of sickle cell and long-term pain. In terms of managing sickle cell helpfully, you're probably aware that it's really important to stay hydrated and to try and keep a nice constant temperature while you're exercising. So it's easy to do this by drinking plenty of water before, during and after exercise, and to make wise choices about where you choose to exercise. So this might be about being aware of things like air conditioning within a gym, or just making sensible choices about exercising indoors and outdoors depending on the weather. In terms of exercising in the presence of long-term pain, it's really helpful to hold in mind the usefulness of pacing yourself. Sometimes, particularly when we're quite enthusiastic, we can try and rush through our exercise and do as much as possible. But it's much more helpful in the long term to take things steadily and maybe take some breaks during your exercise so that you pace your activity throughout that period of exercise and throughout your day. It's also really helpful to think about trying to move regularly. So we think about moving little and often through your day and through your week. So the ideas that we're going to share, some of them are little movements that you could just integrate in your everyday activities, and some of them are a bit more like formal exercise. So play around with them and do a little and often through your week. Then we'd like you to think about doing what you can today, but what you can repeat tomorrow. So sometimes on a really difficult pain day, it might be thinking about, well, is there any movement that I can do today, no matter how small? There might be some parts of the body that feel a bit less threatening to move. That might be the activity to do today. But if you're someone who gets quite enthusiastic, you might want to think about, what can I do today without overdoing it and being unable to do anything tomorrow? So again, it's coming back to pacing and just doing a steady amount of activity that you can maintain. So we really hope you enjoy the exercises and that they give you some ideas. You can always play around with them and change them if that suits you best, and come and speak to us if you'd like more information.